Good afternoon. My name is John Feather. I'm the CEO of Grantmakers in Aging, and we're pleased to be with you today to talk about an important new effort that brings together some amazing partners in the national scheme to work on aging issues in a different way. Joining me today is Emily Allen, who is the Senior Vice President at the AARP Foundation Programs part.
Hi, John.
Catherine Godschalk, who is Vice President of Investments at Calvert Foundation.
Thanks, John.
And Scott Sporte, the Chief Lending Officer at Capital Impact Partners.
John.
Welcome to you all.
Thank you.
Thank you.
Great to be here.
Emily, let's start with you.
Okay.
We know that there are many more older people. We know that population is expanding rapidly. Can you tell us about how that change is impacting on the diversity of the financial resources that older people bring and what we can do about it, particularly in a program like Age Strong?
Absolutely. Thanks, John. It's great to be here and to be talking about this important initiative. You're right. The population, we all know this, the population is aging. And in many ways, that brings about a lot of positive things. There's people that are remaining in the workforce longer. There's a lot of intergenerational opportunities, multi-generational workforces. At the same time, as you pointed out, that also brings a lot of challenges. Because individuals are living longer, many have not saved up for retirement or that longer period of time. So we're really looking at challenges financially for older adults. At the same time, as we're living longer, that puts constraints on communities. And quite frankly, communities are not necessarily well prepared to meet the demands of this aging population, whether it's around issues of housing, around issues of access to healthcare services, food and nutrition. So it's really goes across the board, and that's one main reasons why AARP Foundation is so excited to be part of this. We have for a number of years focused on the basic needs people have in life as they age. Access to food and being food secure, access to affordable and adequate housing, income, ensuring that they can continue to generate income and manage that income to be more financially secure, and ultimately, can they stay connected to their communities and not become isolated? So we see what's exciting about Age Strong is it really covers across the board the challenges that people face in all of those areas meeting their basic needs.
Well, that's very exciting. Scott, let's turn to you for a second. We know that in the current healthcare environment, there's a lot of emphasis on integration of services across the acute care hospital setting, for example, and the community-based long-term care setting. Transportation, health, housing, all of these pieces have to roll in as one. Tell us a little bit about how Age Strong can work in this process and help bring that integration about.
Well, Age Strong is really designed to anticipate the diverse needs of healthcare providers. We can work with the actual primary care provider to help them build a facility. We can provide the working capital they need to be able to secure transportation. We work with a whole variety of organizations that provide care across a full spectrum, from senior assisted living, skilled nursing facilities, primary care, behavioral health care, and then thinking about ways that they can access health care both within their homes and within the bricks and mortar of a primary care facility.
Emily, back to you. A little more specifically, are there other key areas that Age Strong will be part of and have an emphasis about?
Sure. Well, I think, as we kick it off, we're really looking at advancing scalable solutions that are out there. This really sticks with the mission of AARP Foundation of creating or advancing solutions. So we're interested in taking a look at, particularly as Scott was talking about, those integrated service models. Are there new models of care that are showing some promise in communities that just need to be scaled? And so we see some real opportunities, particularly as it relates to connecting the home with medical services. And so we see some exciting opportunities. We've done some work around greenhousing and things like that. It's a good place to start, and it sticks with AARP Foundation's focus on creating innovative solutions. In the future, we'll look at probably more entrepreneurial models, but for right now, there's some great ideas out there that can really connect people, allow them to stay and age in place in their communities, but do so by providing new models of care that allow people to stay connected to their home and their communities.
I'll stay with you for a minute. AARP and the AARP Foundation are obviously the nation's largest aging organization. Been around for a long time, tremendous work over many decades. So tell us a little bit more about the background behind this, about the aging of the population and why this is important and why it's important now, but also into the future.
Sure, absolutely. Well, as you said, I mean, the population is aging. We know, in fact, that within the next few years, you're talking about a 50-plus population that's 130 million strong, huge population. And as I said, that can be a great thing, but it also can produce some challenges. We know that right now, 20 million individuals are struggling with having enough financial resources to meet their basic needs. 9 to 10 million are facing challenges around food insecurity. They don't know where their next meal is coming from. We know that millions of 50-plus households struggle with having affordable housing or living in inadequate housing, and that's a big issue for our population. Is the house is often the biggest resource for an older adult. And so how can we allow people to age in place and have an adequate home so that they can maintain that financial asset?
Scott, you talked about integration of services and so forth before. Tell us a little bit about a concept that we're hearing a lot about, which is age-friendly communities, which tries to bring together a lot of different resources in a community. Tell us a little bit more about that idea.
Sure. I think there are a number of interesting models for that type of community where people want to be able to remain in their homes but need to be able to access services, healthcare, to be able to get their groceries. They want to be able to get out and attend social events and other types of opportunities to socialize with their neighbors. Concepts like the village help bring those services together, bring volunteers within the neighborhood and outside the neighborhood to help connect those services so people don't have to go someplace else, don't have to live in another community in order to receive those needed services. They can stay in their homes and age as they stay there.
So Catherine, we come to you. We've heard the term Age Strong several times. So tell us what Age Strong is.
Absolutely, with pleasure. So Age Strong is really a collaboration. It's an initiative, a partnership between AARP, AARP Foundation, Capital Impact Partners, and Calvert Foundation. It is an investment initiative aimed at directing more than $70 million of private capital to meet the community needs that Emily and Scott were just describing. And it's an investment opportunity for everyday individuals. So you or I can invest through the Calvert Community Investment Note and become a part of the Age Strong initiative.
Why is this different from other programs that are out there that either charitably or otherwise raise funds to help older people?
Well, I think there are a couple of factors that distinguish this from existing efforts. One is really the collaboration among the partners, and the other is the opportunity for everyday individuals to be investing for impact, knowing that their dollars are working to create the realities that they want to see in the communities of need.
You talked about the collaboration between the three of you. I wonder if I could ask each of you to talk a little bit about the role that your organizations will play in this work and a little bit about the organization itself so our audience will know more about how that works. So Emily, how about you?
I can start? Sure, yeah. So AARP and AARP Foundation are really investors in this fund. We have, over the last several years, really looked at social impact investing as a real opportunity to move beyond just programmatic work into more investments into communities and the issues that we care about really across our impact areas, those integrated issues of hunger, housing, isolation, and income. So we're really, bringing the lens of the older adult, and particularly that low-income or vulnerable older adult, to the decisions and the conversations around where the investment should be made. It's in keeping with really our diverse portfolio of doing some grant making, building some of our own programs, as well as making these types of investments in communities. We think it's a great opportunity to not only serve the needs of low-income older adults, but really people of all ages as we invest in these communities.
Scott?
Capital Impact Partners is a national nonprofit community development financial institution. Our mission is to work with people who live in low-income communities who are not served by traditional financial markets. We are fairly unique in the community development world in that we dedicate a lot of our resources and a lot of our thought process to aging communities and populations. We will be receiving some of the investment through the Calvert Foundation from the AARP Foundation and AARP to make loans to organizations that will benefit 50-plus populations around the country. Catherine?
Sure. So Calvert Foundation for more than 20 years has been enabling individuals and institutions to invest for social good. And our role in this collaboration is to, through our investment product, the Community Investment Note, enable individuals to become a part of the Age Strong initiative. We have, over our history, raised more than $1 billion from more than 15,000 individuals and institutions. And we have deployed that capital working alongside strong intermediary partners like Capital Impact Partners. And our investors have received 100% repayment on principal and interest. And so we sort of, just as Capital Impact really works at that intersection in the community of understanding how to structure financial products to address particular needs, we operate at that intersection of the private capital markets and investment and the community needs.
Great. And that's billion with a B, right?
That's $1 billion with a B.
Yes.
Yes.
Yes, absolutely. So a lot of money, but an important need in the community, absolutely. So Emily, let's start talking more specifically about the program. Could you give us some examples of how working together in this Age Strong environment might help a community?
Sure, absolutely. Well, it's interesting. I have spent a lot of time working on the income impact area, and one thing that I'm excited about is the fact that in the past, when we've done things like workforce programs, as an example, and this is where I see kind of some of the differences, we were always kind of told, in reality, we don't create jobs. We may be able to help people train for jobs, but we don't necessarily create jobs. We see this as such a fantastic opportunity to actually create jobs, and that may be jobs for younger people, or it may in fact be jobs for older people. So as we look at investing in things like grocery stores and others, what a great opportunity to put a grocery store in a food desert and have integrated services as part of that model, creating jobs, creating the community services that are needed, and remediating a challenge around a food desert. So we really see this as the opportunity to bring all of these things together and perhaps even create some jobs. So we're excited about that.
It is very exciting, a very different kind of way of looking at it. Catherine, there are already aging funds out there. So what's different about this?
So I think one of the distinguishing elements of this is it's private capital at work with a focus on generating the positive social impact. Philanthropic giving, government programs are critically important and will always remain critically important, but the reality is the governmental discretionary spending is at an all-time low, or a low for the last 30 to 50 years, and we don't see an uptick anytime soon. Charitable giving would have to sort of nearly double to begin to fill the gap that we see in discretionary spending, and directing more private capital smartly, into programs that are sustainable and scalable in order to address the growing demand that we've talked about is, I think, what Age Strong is really focused on.
Also exciting, because it is true that the philanthropic world struggles in the aging world. It's still 2% of American philanthropy goes to aging. So it's a struggle all the time for us to find additional resources. So Emily, how does this take advantage of a shared value kind of proposition?
Good. Well, I think that's a good segue into that conversation, because so often when you think about low-income individuals, you put the mindset of charitable outreach on that. And the fact of the matter is, yes, individuals may be low income or struggling, but in fact they're consumers. And so we see this as a way of creating a shared value in a community, of actually improving the lives of individuals so that they can become solid consumers in their communities. So by having integrated services, by creating age-friendly communities, by putting these services in and improving lives, you in fact help people turn the corner and really go from beneficiaries into consumers. And that's such an exciting piece for us, is to really change that conversation particularly around a low-income older adult audience.
Well, Scott, as we talk about the practicality of this program, so many community-based organizations, many of which are smaller, are very afraid, truthfully, or reluctant to take on debt. What is it about this program that should encourage them to think about this as an opportunity? What kind of things should they be looking at?
Well, I think an important consideration is the fact that we have worked exclusively in underserved communities. The programs and the products that we develop are flexible. They keep in mind the unusual nature of nonprofit financing and funding. And we spend a lot of time understanding the individual needs of each borrowing organization. H Strong is not a product that's intended to say, here is your one-size-fits-all solution. We are listening to what the needs are in the community and adjusting the financing to help meet those needs as best we can.
Well, I'll stay with you on that question. What types of borrowers do you think of when you think of this program? Are there ideal borrowers for this effort?
Well, we can finance a full range of organizations. Ideal borrowers are those that are going to focus the benefits of their work on populations age 50 and older. And those organizations can be nonprofit social service providers, healthcare providers, skilled nursing facilities, but then organizations that help provide or increase access to fresh, healthy food to help low-income seniors increase their ownership of assets by purchasing their own homes or their manufactured housing, to be able to own an asset that helps them grow and be stronger financially as they age.
So I'm one of those CEOs of a nonprofit community-based organization, and I'm coming to you and saying, so what kinds of things can you fund?
We can finance virtually a full range of needs that really can benefit your project development. We think about financing a facility, can help finance the construction or the acquisition of a building. We can provide long-term financing for that same facility. We can help finance equipment. We can provide some working capital financing and the dollars needed to purchase inventory if you're a fresh food retailer, for example.
Okay, those are great examples. And I'll stay with you for one more. Are there any particular types of projects you're looking to fund initially as opposed to later on as the project develops?
That's a really good question, because I think one of the things we haven't really talked about much is that we see that there are two phases to Age Strong's development. And the first phase is working a lot with bricks and mortar type facilities, actual providers of or deliverers of healthcare services and fresh, healthy food. But as we're thinking about the second phase, we're thinking about more innovative ways that we can benefit the 50-plus population. So that might turn us more toward technology, workforce development, job creation, other new ways of asset building for low-income seniors.
Catherine, there's an interest in impact investing. It's a term that will be familiar to some in the audience, but probably not to others. So if you could tell us a little bit about what that is in terms of, and how it particularly relates to community-based solutions in aging.
Absolutely. Well, I describe it as part of the broader umbrella of sustainable investing or socially responsible. But impact investing or community investing really gets at knowing that your investment dollars are directly at work in communities, in low-income, underserved communities, to generate the impact that you want to see. And one of the things that I think is really exciting about Age Strong is it's enabling people, we can all relate to the issues of aging. It's something that really hits home for many of us. And the opportunity to make an investment, know that you're going to be getting a return of your capital, a return on your capital, as well as an impact as a result of that investment, I think is a really powerful one. Impact investing, I think, has really, itself as a term is relatively new over the last, 5 years, right? But it depending on what you look at, it can be sized at, 500 billion to almost $1 trillion. Right now. It's growing faster than the financial services generally sector. So the interest is really peaked, and there's a lot of appetite, I think, for people to know that their investment dollars are making a difference. And I think Age Strong is an opportunity that can really begin to meet that demand from the investor side.
So how does at a nuts and bolts level, how does the investment
Right.
actually
How
work?
do you do it?
How do you do this?
Well, there are a couple different ways. So you can invest directly on Calvert Foundation's website for a minimum of $1,000. You can invest through your brokerage account for $1,000. Or what I'm most excited about is you can go online and invest for as little as $20 and become a part of Age Strong. The community investment note and this targeted Age Strong offering is a fixed income investment. You select your term. We offer 1, 3, 5, 7, and 10-year terms with an interest of 0.5% through to 3%, depending on the tenor that you choose. And it's part of your investment portfolio.
Well, can I invest out of my retirement account, for example?
Self-directed IRAs can invest in the community investment note. If you were to go to www.agestronginvest.org, there's an FAQ section that has a lot of information, including on sort of what Age Strong is about, but also including how to invest. And that will give you a more detailed information and description of how you can invest your IRA.
And where does the investment actually go? Is it something you maintain, or how does that actually work?
Yeah, well, as Scott was describing, all of the Age Strong community investment notes channel through to a fund managed by Capital Impact Partners that they are deploying in communities, financing a lot of the assets that you were just describing.
Mm-hmm. Emily, back to you. What are some examples of innovations that are scalable? And what really do we mean by scalable when we talk about community-based organizations?
Sure, no, that's a good question, and certainly something that we have been looking at for a number of years. One of the things that we're doing is taking a deeper dive on evaluating some of the programmatic work that we've been doing. So, for example, as we were talking about kind of the access to food and nutritious food, we've been working on the Food Nutrition Incentive Program, where it's really helping people incentivize using the SNAP benefit with getting healthy fruits and vegetables and things like that. So again, it kind of goes back to the shared value piece. Not only are we looking at that program, but really syncing up with grocery stores and others in order to make it work not only in a community, but then more at a broad scale, and really have the proof points at a community level. Scale could happen within a community, but what we really look at is how can we take great work that's happening in one community and take it elsewhere, and really have those proof points that the outcomes that you want to achieve, whether it's access to food and nutrition, whether it's job development, whatever, is really happening, and then being able to take it elsewhere and replicate it across the country.
Scott, to follow up on that question, when we talk about scale, are we talking about also larger than a community? Are you talking about regional or national programs as well as local individual programs?
We are, although ultimately it all comes down to the community. So we're working with organizations that do have a national footprint, that are working with communities all over the country. We're working with hyper-local organizations that are focused on maybe a 2-block area. It doesn't really matter what their geographic footprint is. It really matters how they're able to target their investment to benefit 50-plus populations.
Well, as we come to the close of our presentation today, I want to ask each of you to tell us a little about why you think this is important, why it's important to you and your organizations.
I think through the partnership and the collaboration, we will demonstrate that the coming together of 3 organizations with very complementary strengths is going to result in, I hope, a really powerful impact in communities. And I'm really excited that it's an initiative that anybody can become a part of.
Scott.
I would really echo that. So if you make a deposit at your local bank, you don't know where that money's going. If you make an investment in the Calvert note, you know that money is going to be lent into and benefit low-income populations, people age 50 plus, and help them access better food, better housing, better health care, help them build their assets. There's a direct connection between the investment and the loans we're making in those communities.
Great.
For me, I think it's that we're thinking differently, thinking very, very differently. And I think the fact of the matter is we all have one thing in common. We are all aging. And so, in fact, what we can put into place today will only benefit everybody at some point. The fact that we would be investing in communities and putting, better access to services is probably going to benefit the young person as well as it's going to benefit the older adult. But at some point, it's going to benefit all of us. So the collaboration and thinking differently and engaging people in very, very different ways is, I think, at the core of what makes Age Strong so exciting.
Well, thank you all. This is a very exciting effort and really a game changer in the way in which we might be able to bring private capital in to meet the needs of this very, very large and growing segment of the population. So thank you all.
Thank you.